Imagine ChatGPT telling your doctor that your procedure that they have done scans, have done all the necessary things, and all of their medical education just out the window because ChatGPT came back and said that you don't need this procedure. Now, here's the thing. They are absolutely exploring AI, telling you all whether or not certain Medicaid recipients will be able to get certain procedures. Now, will they be using a program a little bit more sophisticated than ChatGPT? We hope that it will have the parameters a little more sophisticated, but I guarantee you there's going to be hella flaws because you have people who are setting this up that have no understanding of how Medicaid actually works. And the fact of the matter is that they always feel like elderly people and certain disabled people are expendable. Um, this is going to be really interesting because you have people like Dr. Oz. Again, Oprah, please come get your homeboy. This your boy. Now, that they are saying that the wasteful service reduction model is going to absolutely reduce wasteful spending within Medicaid. And see, everybody's like, oh, yeah, well, we want to, squelch, wasteful spending and all the things. Of course, nobody wants to waste anything. But think about it when it's your Mima that is needing a critical situation to be assessed. And they come back and say, oh, well, we feel like, we can just send her this Tylenol and she'll be fine. Now they're saying that, oh, if it's critical stuff, they're not going to, allow this model to be used on that. So they say. And they keep saying that the final decision will come down to an employee. Um, but here's the thing. How do we know that the employee is human? And what is going to be the recourse when you need to appeal this? How long is that going to look? Because remember, they're streamlining this to make this faster so that, procedures can be done quicker and that basically they can turn over these beds and things. Explain to us how they are going to make this faster. Explain to us how it's going to be any different and, more streamlined, especially dealing with people who do not understand how Medicaid absolutely works. Now, of course, if you know anything about, you pretty much know that the claims go by pretty quickly and then, they will go ahead and process it and go about their business. However, here's the thing, here's the catch. There's a little piece of compensation for each one of these programs that denies a claim. Now, it's going to be interesting. Will they get compensated if, the claim is appealed and they go back and deny it again? And is appealed again, and do they get another piece if it's denied again? And then where is this money coming from that they're going to be getting this kickback from? So, Medicaid is going to also pay for them to use said AI program. It's giving, lottery all over again. Remember how they said, oh, we get the lottery, schools are going to be so well funded, teachers are going to get all these raises and all the things, and now look where we are. But let Dr. Oz tell it, it's going to crush fraud, waste, and abuse. It's going to crush it. It's going to make sure that, everything is going to be streamlined. And again, wait until that is your Meemaw Peepaw or your child with disabilities who has some type of chronic illness. Then what happens? Because a system that does not understand the way a human body absolutely works differently for each patient. But they swear up and down a human will have the final say. America's not a real place, and y'all, they absolutely have robots determining whether or not you get health care with taxpayer dollars in New Jersey, Oklahoma, Ohio, Texas, Arizona, and Washington.
Like and subscribe to Mom's channel.